Hello everyone, this is Henry of the Smart RN channel. In today's video, we are going to look at ventricular dysrhythmias. Now, ventricular dysrhythmias are those ones that originate in the ventricles. And because they originate in the ventricles, they do not have P waves. The QRS complexes of these ventricular dysrhythmias are very wide. We expect a QRS to be up to 0.12 seconds. But those ventricular dysrhythmias have QRS complexes that are greater than 0.12 seconds. Now, ventricular dysrhythmias include premature ventricular contractions or PVCs. We have ventricular tachycardia or VTAC, and then we have ventricular fibrillation or VFib. So these are the dysrhythmias that we are going to consider as we go on. So let's start with premature ventricular contractions. Premature ventricular contractions, or in short PVCs, are extra heartbeats. And as we have seen, these extra heartbeats begin in the ventricles. The impulse that initiates these extra heartbeats originate from pacemaker cells, which are located in the ventricles. Now, in most cases, these extra heartbeats disrupt the regular rhythm of this patient. Now, what we mean is that this patient has a regular heartbeat rhythm, and these PVCs normally occur as a disruption to that particular heartbeat rhythm. And that's why we say that they are extra heartbeats. In other words, they are heartbeats in addition to the regular heartbeat rhythm of that particular patient. Now, when they disrupt the regular heartbeat rhythm of that patient, the patient feels a fluttering or a skipped heartbeat sensation within the chest. So, as we have said, they originate in the ventricles and therefore they do not have any P waves at all. Now, PVCs can be unifocal. Unifocal PVCs are those ones that originate from one ventricular pacemaker. In other words, the rhythm, the electrical impulse that causes these PVCs originates from the same pacemaker cells in the ventricles. That's why it's called unifocal. They only have one ventricular pacemaker within those particular ventricles. PVCs can also be multifocal. In other words, they can be caused by multiple pacemaker cells. We can have a number of pacemaker cells located in different locations within the ventricles. And when this happens, we refer to them as multifocal PVCs. So we can have, for example, in that area, there are pacemaker cells in that area. There are also pacemaker cells in that area that cause this particular PVC to take on a different morphology. So these are multifocal PVCs. We can also have couplet PVCs. These are two PVCs in a row, two PVCs occurring one after the other. So we have a normal heartbeat that's now disrupted by two PVCs in a row. So these constitute what we refer to as a couplet. We can also have a triplet. A triplet are three PVCs in a row. And when we have three or more PVCs in a row, we refer to that as ventricular tachycardia. And that's why this triplet is at times referred to as a 3-beat run of ventricular tachycardia. 3 beats occurring one after the other. So we have a normal heartbeat that is disrupted by 3 premature ventricular contractions. Remember, before every one of these PVCs, there is no P wave. So that's a triplet. PVCs can also be bigeminy. By bigeminy, we mean that every other beat is a PVC. So we have a regular heartbeat, then a PVC. A regular heartbeat, a PVC. So like in this case here, I will have, for example, we'll have a normal heartbeat, a PVC. Then a normal heartbeat, then a PVC, which could either be in a different particular location, but every other beat is a PVC. Normal heartbeat, PVC. Normal heartbeat, PVC. That's about us a bigeminy. And a trigeminy is where every third beat is a PVC. First beat is second beat, third one is a PVC. The first beat, the second beat, third one is a PVC. So 2 normal beats followed by a PVC. 2 normal heartbeats followed by a PVC. So that one is referred to as a trigeminy. What are the causes of PVCs? There are a number of things that can cause premature ventricular contraction. Hypoxia, reduced oxygen in the blood, myocardial infarction, when cardiac cells die because of inadequate perfusion. We have cardiomyopathy, can lead to PVCs, electrical imbalances. That means, for example, when potassium, increased potassium or decreased potassium, that's electrical imbalances. They can cause PVCs. Hypertension, elevated blood pressure, recreational drug use of things like cocaine, they can send a patient into the heart, into PVCs. We have increased adrenaline. For example, when somebody is exercising, there is increased adrenaline. When somebody becomes very anxious, increased adrenaline is produced in the body. So this increased adrenaline can result in these PVCs. And then we have stimulants like tobacco and caffeine. So smokers and those people who use caffeine, they are likely to have PVCs disrupting their regular heartbeat. So how can we know, or what are some of the signs and symptoms that can accompany a premature ventricular contraction? One, we can have dizziness, patients feeling dizzy, lightheadedness, shortness of breath. We have fainting, they can faint, anxiety. Remember, we said they have fluttering or skipped heartbeat sensation. They can send them into anxiety mode. We have palpitations within their chest, like their heart is beating out of their chest. We have hypotension. This is as a result of this particular, these are some of the signs of that particular premature ventricular contraction. So what are the nursing interventions? As a nurse, what is expected of you when taking care of these patients with PVCs? As always, you are assessing with that, you are performing assessments on that patient. What are you assessing? You are assessing the patients, you are assessing the blood pressure, you are assessing their pulses, you are monitoring their level of consciousness. So you are with this patient performing assessment. Determine the underlying rhythm. As a nurse, remember we said that PVCs disrupt the normal heartbeat rhythm or the regular heartbeat rhythm of this patient. We said there are extra heartbeats in addition to their rhythm. So what is the underlying rhythm of this particular patient? Determine what is causing these particular PVCs. Are these patients smokers? Do they use drugs? Excuse me. Are they in anxiety? For example, are we having increased adrenaline causing this particular PVC? So determine what is the likely cause of this particular PVC. Administer any medications which have been ordered by the primary provider. Another very important thing is that educate the family and the patient. Educate the patient and the family. So what are you educating them on? One, educate them on the causes. What are the causes of these PVCs? They educate them to know what are the causes of PVCs. What are the likely cause of the PVC in their situation? So educate them on the causes of these PVCs. This will enable them to be able to identify what could be the likely cause of PVCs in their situation. So educate them about the causes of PVCs, the signs and symptoms that accompany premature ventricular contractions. Teach them on smoking and drug use cessation. If these patients are smokers, teach them how to cease smoking. If they are drug use, teach them how to the importance of stopping this particular practice of drug use. So educate them on smoking and drug use cessation, and then teach them teach them on the importance of seeking help. Let them seek medical help. Let them seek medical help when they are having this particular PVC. So these are the things that as a nurse, you can educate this particular patient together with their family. So that brings us to the end of this video on premature ventricular contractions. From me here is goodbye.